Medicare Part D is about prescription drug coverage. There are essential facts you need to know. In 2025, there was a whopping 464 Part D plans out there, with over 53 million people riding the Part D wave, and Medicare dishing out more than 135 billion with a B, dollars on these drug plans. But here's the kicker. You're not forced to sign up for Part D. Part D is not required, strictly speaking. Some people on no medications or very few medications even opt out of taking Part D. That is a massive mistake, especially when your health and your wallet is on the line. Here's why all this matters. As we age, health issues multiply. The drugs to deal with health issues can be expensive, many times more expensive than the average person can comfortably afford. On top of that, if you don't choose to get a Part D plan when you're first eligible, there is the possibility of a penalty that grows with each month you don't have a plan. You will regret that penalty later. They all do. My name is Chris Grimman with Omaha Insurance Solutions. I have over 2,000 Medicare clients and more than a decade of experience helping with Medicare Part D plans in the Omaha, Bellevue, Lincoln, and Council Bluffs metro areas. I'm dedicated to helping you confidently navigate the complexities and confusion of Medicare. Today, we're breaking down Medicare Part D plans, what Medicare Part D is, what it covers, how it works, and why you absolutely need it. Let's dive in. First, what exactly is Medicare Part D? Hard to believe, but Medicare didn't cover prescription drugs before 2006. In the 2000s, medication costs were soaring. One vial of Humalog insulin cost $21 in 1999, and by 2019, it was $332, more than 1,000% increase. Congress expanded Medicare insurance to include prescription drug coverage in 2006. Private health insurers partnered with Medicare to offer Part D plans to make medications affordable for seniors. But like most government programs, they are confusing and sometimes burdensome. During this year's Medicare annual election, I met with a fiery 79-year-old business owner who heard of us on the radio. Let's call her Betty. Betty came into the office to see if I could save her some money on her Medicare supplement. I showed her a plan that would save her about $1,000 a year. Betty was in superb health, so she passed the underwriting questions with flying colors. We changed her supplement. But during the course of our interchange, the conversation, I discovered Betty didn't have a Medicare Part D plan, and her doctor had just put her on Eliquis. If you don't know what Eliquis is, it's a very expensive heart medication. She complained about how much she was paying. Betty never took any medications before, at least until Eliquis. So now, because of that, she never got on a Medicare Part D plan. I showed her how much she would save in medication costs if she had a Part D plan, so she was interested. But when I told her she would have a penalty for the 14 years she didn't have a drug plan, she was spitting mad. I reminded her I was just the messenger. Medicare was the one that made the rules. Eventually, she cooled down. We enrolled Betty in a Part D drug plan, but her monthly penalty was around $66 per month, more than the monthly cost of the drug plan itself and the copay for the Eliquis. The whole thing, however, was still cheaper than paying cash for Eliquis, which is about $650 per month. Another fact to know about the Part D is the penalty for not having a drug plan grows with each month you don't have the drug plan. So Betty benefited by purchasing the drug plan. It stopped the accrual of her monthly penalty. And the penalty, if I didn't mention it, is a lifetime penalty. You can't pay it off. It's not for 1 year, certain period. It's as long as you have a Part D plan, you're paying that penalty every month for the rest of your life. Number two, what does Part D cover? When I meet with prospective clients, they're nervous. Questions they have are, will my prescription medications be covered? Can I afford the medications? Or If I get something bad later on, will I be able to afford the cure? All Part D plans cover brand name drugs, generic drugs, medications for chronic conditions like diabetes or high blood pressure, short-term meds like antibiotics, vaccines, including the shingle shot, RSV, tetanus, diphtheria, COVID. Each plan has what's called a formulary. In other words, a list of covered drugs. Medications will have different costs depending on the plan you choose, so reviewing this list, the formulary, is critical. You can ask for an exception if you discover one of your medications is not on the formulary, but getting that exception is not fun, even when it's granted. So you want to avoid that. Check the formulary before you enroll in the plan. USP, United States Pharmacopoeia, is a published list of medications by the USP Convention that outlines the categories and standards for medications. Part D plans use the USP model guidelines classification structure. So each Part D plan must have at least 2 different medications in each therapeutic category of medications. There are over 50 categories. The plans are free to have more than 2, but they must have at least 2, and the 2 have to be different, chemically different. They can't be similar. So you are going to find whatever medication you look for. Maybe not your brand, but they're going to be covered. There's also protected classes that the drug plans must cover. There are 6 protected drug classes. They're mandated because many of them are critical for survival. The protected drug classes are 1, cancer drugs. I have several clients on these medications. They're self-administered. Some of these are incredibly expensive. Clients tell me they have to take them after their cancer treatment for the rest of their life just to stay alive. 2, HIV/AIDS medications. Thanks to the Ryan White program, many of the HIV drugs are free to those who have HIV, but Medicare mandates that they also be on the drug plans to ensure those living with HIV/AIDS receive comprehensive coverage without any gaps. 3, antidepressants. Mental health is as crucial as physical health, so one of the screenings Medicare allows to be done repeatedly is for depression. Medicare recognizes that managing depression can be life-saving, so most antidepressants are covered, giving you access to a wide range of options tailored to whatever your needs may be. 4, antipsychotics. For those managing severe mental health disorders, antipsychotics are indispensable. Every medication in this class must be on the formulary, ensuring you get consistent care. 5, anticonvulsants. I met with a client today who has epilepsy. My son has epilepsy. I know how critical these medications are for survival. 6, immune suppressants for organ transplants. My father had a kidney transplant many years ago. We always worried about him taking his anti-rejection medications. He was pretty lackadaisical when it came to taking medications, but my mother and his grandkids put the fear of God into him, so he religiously took his immune suppressants to his last day. To control the cost and make sure you're choosing the lowest price plan, you can search your drugs on the website, the Medicare website, medicare.gov. It's the official site and place to research Medicare plans, Part D plans, the Advantage plans. You can also call us. We can help. Our state-of-the-art software quickly analyzes all the Part D and Medicare Advantage plans in your zip code, anywhere in the country. The plans and the medications are laid out in an easy-to-understand format. You'll immediately see which drugs are covered or not. The plans are listed in order of cost, breaking down the individual monthly and annual prices for the prescriptions. Side-by-side plan comparisons makes it real easy to figure out which plan is better suited for your situation. You then decide based on your own budget. After our free consultation, you just take all that information, print it out, we can email it to you. You have all the information you need to make an informed choice about your Medicare Part D plan. Enrolling in the Part D plan is as simple as a few clicks of the mouse. Call us with the list of your medications for a free consultation. 3, how does Medicare Part D work? When people show up at the doorstep of Medicare at age 65, or if you delay it, 66, 67, 68, etc., the big question is, how does this Medicare thing work? Many people, their employer health plans and human resource departments took care of everything for 20, 30, 35, 40 years. They didn't have any real choices, and now with Medicare, they're on their own, solo. Calling Social Security or Medicare for help is not real helpful. So you're on your own. Here's how Medicare Part D works. Private insurance companies approved by Medicare create drug plans to reduce the cost of medications significantly. Congress recently made some historic changes to the structure of Part D plans. Part D plans are broken down into 3 stages. The first stage is called the deductible stage. Most standalone Part D plans have a deductible. This year, 2025, it's up to $590. Many Advantage plans this year have added deductibles to the drug portion of their plans. You pay full price for your meds in the deductible stage until you reach the full deductible amount, whatever it might be. Like I said, $590 this year in the standalone plans. Your tier 1 and 2 drugs, they're very inexpensive. They don't count towards the deductible. Stage 2, the initial coverage stage. After hitting your deductible, you'll pay co-pays or co-insurance for your prescriptions. Once you've paid as much as $2,000 out of your pocket, so out of your pocket for your medications, you will move into the 3rd stage. Now, if you don't spend $2,000, fantastic. But if you do spend $2,000, you'll move into the 3rd stage. The new stage is called the catastrophic coverage stage. If you pay $2,000 out of your pocket, Medicare will cover your medications at that point 100% for your drug costs for the rest of the year in this final stage. You pay nothing, zero, nada. That's a huge relief for those on high-cost medications. If you're new to Medicare this coming year, this may not really hit you, but anyone who's been on Medicare for any length of time on expensive medications, they know how big this is. The donut hole is gone in 2025. If you don't know what the donut hole is, don't worry. If you know what the donut hole is, celebrate. Costs will be lower and more predictable, making it easier to budget for your medications. This change makes Medicare Part D plans even more critical for your success in retirement. So 4, why do you absolutely need Medicare Part D? Getting through the last years without medications, including expensive medications, is statistically improbable. So why risk it? There are many low-cost Part D plans and zero-premium Medicare Advantage plans with the drug portion. Get one because without a Medicare Part D plan, Eliquis is going to be $650 per month. Xarelto is $634. Januvia, $345. Trulicity, $863. Humira, $550, and many other drugs. So why risk it? You don't want to be one of those seniors who eat cat food to afford their medications. If you don't get your Part D now, you'll probably get it later anyway, but with a nice fat penalty, no exceptions. Now you know what Medicare Part D is, what it covers. It's the most comprehensive drug program out there, how it works. There are 3 stages with that $2,000 cap, potentially saving you thousands. The reason you need Part D is because medications and high-dollar medications are probably in your future, and the low cost of a Part D plan means there is no need to take risk of going without or ending up with a penalty. Finding the right Medicare Part D plan isn't a one-size-fits-all proposition. That's where we come in. Let's chat about finding the Medicare Part D plan with the formulary that covers all your medications at the lowest possible cost. Why overpay? So if you're ready to take control of your healthcare and save money on your prescriptions, hit up Omaha Insurance Solutions for a free consultation. Visit our website, omahainsurancesolutions.com. Speak with one of our licensed insurance agent professionals. If you find this video helpful, smash that like button, subscribe, and hit the notification bell for more Medicare hacks and insider tips. Stay informed, stay covered, and I'll see you in the next video.